I'm Adam Olson, a certified financial planner with Mutual of Omaha, and I'm here on the Money Master Unleashed podcast again today to help you live your best retirement. And part of that living your best retirement is going to be navigating your healthcare cost. So I'm going to give you strategies today to give you peace of mind and help you plan accordingly to fund your healthcare expenses in retirement. Today's episodes, I'm going to cover what some basic healthcare costs are, what you need to plan for, and how this cost could potentially to add up to hundreds of thousands of dollars in retirement. So I'm going to talk about Medicare, I'm going to talk about long-term care, and I'm going to talk about how we can control these costs for you inside of your retirement plan. Now, I have wrote a book called The Red Zone Retirement Plan that's available on Amazon and on my website, adamdolson.com. This book will go in depth into these concepts that I'm talking to you about today. So feel free to check that out if you'd like more information after this video today. So first, we need to really understand what healthcare costs you could potentially have in retirement time. Well, there's going to be cost of insurance, there's going to be premiums, out-of-pocket cost, and you're also going to have copays and deductibles. Don't forget about those things. These costs are going up every year in part because really insurance costs are going up. You're going to have more healthcare issues as you age generally, and also drug prices are a big pain point for a lot of retirees right now. So there's a Fidelity study that comes out every year. This most recent one, according to the Fidelity Healthcare Cost Estimate, a single person age 65 in 2023, they may need around $157,000 saved after taxes to cover healthcare expenses in retirement. And the average retired couple age 65 in 2023 may need around $315,000 to pay for these healthcare costs. Safe to say that's a big chunk of change, and you need to pay attention to make sure that you're ready for this inside of your retirement. Let's start with the very first thing you need to know about, which is Medicare. Now, Medicare starts at age 65. So if you're retiring before age 65, you need to plan on your health insurance before Medicare hits. This episode isn't going to cover that, but I do cover topics like that in other videos on my YouTube channel, so check those out. So basically, Medicare has four parts: Medicare Part A, B, C, and D. So Medicare Part A is your hospital insurance. Medicare Part B is your medical insurance. These things are through the federal government, and generally speaking, it covers about 80% of your healthcare costs in retirement. Now, the other 20%, you're going to need to get other types of insurance policies to cover those out-of-pocket costs. So that's where we get to Part C, which is an Advantage plan. Now, an Advantage plan is your medical insurance and your drug insurance generally together. And those two things coupled together will cover most major things that you have, and you'll have some small deductibles and small copays along with a max out-of-pocket. And then D is the drug insurance. So Medicare Part A is free. There's no cost to that. Medicare Part B, the cost this year in 2024 is around a little over $170 a month. But if your income is high, you may pay a higher Medicare Part B premium. This is called an IRMA surcharge. Now, I have a previous episode on that you guys can check out, but this is why income planning and tax planning is extremely important in retirement time, because that IRMA cost can add up to thousands of dollars year in and year out in extra Medicare premiums. So Medicare A and B through Medicare covers 80%, and you get other supplemental type policies to cover the extra 20%. Now, if you don't enroll in Medicare when you're eligible at age 65 and you do not have employer coverage, you may have to face enrollment penalties and late penalties if you want to get it later in life. So make sure that you're working with a Medicare expert to time the loss of your employer insurance and when you're getting on Medicare, just to make sure that you don't potentially face penalties that could last your entire life. Now, you also need to have a good understanding of Medicare Advantage plans and Medigap or Medicare supplement policies. So let's get into this. A Medicare Advantage plan is an all-in-one solution that you can do. So a Medicare Advantage plan, it's your medical insurance, it's your drug insurance, and there's usually dental, vision, and hearing coverage inside of there as well. These plans are getting more and more popular as the years go on, and we're using them for a ton of our clients inside of our practice as well. What's nice about these plans is they have multiple options from multiple companies, and you can switch them every year during open enrollment, Medicare open enrollment, at the end of the year if you decide that you want to switch plans. Now, if you don't like the Advantage plan plans to look at, you can always look at a Medicare supplement plan. So a traditional Medicare supplement plan, a Plan G, is what we're doing for a lot of clients today. And the way a Medicare supplement plan G works is you have Medicare A and B and your Medicare supplement plan. Now, between those two things working together, the most you'll pay out of pocket is the deductible of Medicare covered expenses. The deductible right now on these plans is about $250 per year. Now, if you do a Medicare supplement plan, you're also going to want a prescription drug plan or a Part D plan. I'm just going to say this when it comes to these things. Everybody's needs, wants, and desires are different. So you need to make sure that you're working with an advisor or a Medicare expert who understands what Medicare Advantage plans are and what Medicare supplement plans are in your area and which plan really is going to best fit you based upon your health and your overall retirement budget. You can switch these things usually every year during open enrollment, so make sure that you're reviewing these things as the years go on as well. So what other healthcare costs can you expect to pay? Well, you have long-term care cost as well. Don't forget about this. The odds are extremely well that if husband and wife reach age 65 that you're going to need some form of long-term care. So you need to plan for this. So why do you need to plan for this? Because if I have a husband and wife and say the husband enters a nursing home facility, it could potentially ruin the wife's retirement plan because of the high healthcare cost for him in the nursing home facility. So there's a lot of different types of long-term care insurance contracts that you can look at. There's hybrid policies, there's traditional policies, there's investment, asset-based type of policies. Just make sure that you're working with an advisor who understands the multiple product solutions that are out there and plans for you inside of your retirement, what you can do to make sure that this doesn't impoverish your spouse if you were to enter a long-term care facility. This cost can be $50,000, $100,000 plus dollars per year, and it can quickly drain your retirement accounts. So plan for long-term care when you're looking at your retirement account. Now, one thing that we can use to help with some of these costs is a triple tax advantage product called an HSA account. So if you're working and you have access to an HSA, I would highly encourage you to look at this as an option for you to help pay for some of these healthcare costs in retirement. So an HSA plan, you put in money pre-tax, and we can use it for these healthcare costs in retirement tax-free. So it goes in tax deductible, grows tax-free, and we can take it out tax-free to help pay for some of these costs, such as your Medicare Part B premiums, prescription drug costs, doctor's visits, surgeries, long-term care policies, etc. So don't forget about the HSA when you're planning to use some of these expenses. Another couple other things that can really impact your cost in retirement are prescription drug cost. So a lot of people today are having real issues month in, month out in retirement because these prescription drugs they're getting are extremely expensive. And part of controlling these prescription drug costs, I understand some of these things you have to have, but we can control some of these costs by being preventative with your healthcare. That means getting regular checkups, regular exams, living a healthy lifestyle, both mentally and physically. And so take advantage of, if you're on Medicare, the annual free checkups that you have. Take advantage of the Medicare covered preventative services, and that may help to lower some of these potential healthcare costs that you could experience in retirement. So how do we budget for these healthcare expenses? So obviously we're going to have Medicare premiums for Medicare Part B. You may have an Advantage plan premium or a Medicare supplement premium. You may also have a prescription drug cost premium. On top of that, you're going to have copays, deductibles, and some out-of-pocket cost. And don't forget about the potential long-term care expenses that you can have. Now remember, these costs estimated for a married couple reaching age 65 is $315,000 for that retirement. So you can plan for this by doing a couple things. Number one, take care of yourself. Be physically active, be mentally fit as well. Number two, utilize that HSA plan. HSA plans, you can put tax-free dollars in, and you can use that for a lot of different healthcare expenses that you could potentially have in retirement. The second thing that you can do is you can get a long-term care coverage. Get a long-term care policy of some kind. Either look at a hybrid, a traditional plan, or maybe an asset-based long-term care plan. That could potentially significantly reduce these healthcare costs that you could face in retirement. In closing here, you're going to have a lot that comes your way in retirement. We can control a lot of these healthcare expenses through proper insurance planning. So make sure part of your retirement plan includes a comprehensive insurance plan as well. Understanding Medicare is key. Understanding what supplemental plans to get is also key. And if you have an overall insurance plan, this could potentially significantly reduce your out-of-pocket cost in retirement for your healthcare related expenses. In addition to that, I talk about it extensively in the Red Zone Retirement Plan, is the IRMA penalties for higher income individuals on their Medicare plans in retirement year after year after year. So to make sure that you don't pay this penalty, check out the book. It's on Amazon and it's on my website, adamdolson.com. This episode hopefully has been extremely helpful for you when you're planning for your healthcare cost in retirement. If you found it helpful, please like the episode and share it out. And stay tuned for more from the Money Mastery Unleashed podcast, where I'm helping you live the retirement of your dreams. This podcast is for educational purposes only and may include references to concepts that have legal and/or tax implications. It's not to be construed as legal or tax advice. Such information or opinions is subject to change without notice and is not intended to use as an offer or solicitation with respect to the purchase or sale of any security, insurance products, or offer of individual investment advice. Any strategies discussed may not be suitable for everyone. Mutual of Omaha Investor Services, Inc. does not provide legal or tax advice. Please consult with your appropriate professional regarding your personal situation prior to making any financial decisions. Securities and advisory services offered through Mutual of Omaha Investor Services, Inc., member FINRA SIPC. Riser Insurance is not affiliated with Mutual of Omaha Investor Services. Investing involves risk, including the possible loss of principal. Past performance does not guarantee future results. Diversification does not guarantee a profit or protection lost against loss in a declining market. Purchase of life insurance is subject to meeting underwriting requirements. There is no guarantee if an individual will be insured. Annuities are long-term investments designed for retirement purposes. Withdrawals of taxable amounts are subject to income tax, and if taken prior to 59.5, a 10% federal penalty tax may apply. Guarantees are backed by the claims paying ability of the issuer and are subject to their terms and conditions.